Now, talking about pancreatic issues, the pancreas is important because it's supposed to help us absorb the end product of digestion when it comes to proteins, fats, and carbs, right? Well, we can have two basic issues. We can have pancreatitis, and we can have pancreatic cancer, right? Well, both of these conditions will be manifesting very similarly in the sense that initially there's no manifestations for cancer because you'll have some type of a mass, and that mass, generally speaking, doesn't create the obstruction of the outflow of the digestive enzymes until it's well developed, meaning until the cancer is pretty much spread. However, pancreatitis, we do have a segment that's known as acute pancreatitis. And when we have acute pancreatitis, we're going to see a lot of clinical manifestations instantly. So let's talk about that real quick. When there's some type of obstruction of the outflow, the digestive enzymes begin to push back, and they start putting pressure on the acinar cells. And this causes the digestive enzymes, primarily amylase and lipase, to increase in our serum levels, meaning our blood values are going to have an increased amylase and lipase serum values because the output of those digestive enzymes is being obstructed by either a stone or some degree of inflammation, or it could even be a tumor. But when we talk about pancreatitis, without the cancer, this happens instantly because there's some type of obstruction. Keep in mind that amylase and lipase will be increased, but we really like to look at amylase, serum amylase, because it gives us more detail as to how the condition is developing. Okay, this becomes a much more useful blood marker because it gives us more information compared to the other digestive enzymes. When people have the backing up of those digestive enzymes, there's going to be a lot of pain associated with this condition. It's important for us to remember that the pancreas is located behind the stomach to a certain degree. You have the stomach, okay, and then you have, of course, the duodenum, and then you have the pancreas that it's kind of located right there. Now, because of this, when the patient has pancreatitis, the patient's pain is going to be exacerbated as they lay down flat, supine. The pain is going to radiate down towards the back. Those are all indications that the patient has something going on with the pancreas, such as in pancreatitis. A lot of things can cause pancreatitis, like alcohol consumption, gallstones, because that's going to cause inflammation. Alcohol actually increases the secretion of the enzymes and makes the fluids a lot more viscous, a lot more thick, and that continues to increase the likelihood of somebody developing like a plug somewhere in here that prevents the outflow of the digestive enzymes. When we were talking about gallbladder issues, we discussed that the patient will have pain in the right upper quadrant when they consume fats, because that's what stimulates the gallbladder to excrete its bile, correct? But when somebody has pancreatic issues, anything in the diet can contribute to the pain. Fats, proteins, carbs, because all of those are being released so they can be activated in the duodenum and help absorb all that nutrition, right? So these patients that have pancreatic issues are going to be placed on NPO, nothing by mouth. And if they're placed on NPO, you have to now consider the potential side effects or complications, nursing implications. What are you guys concerned with? Well, the patient's NPO, their mouth is going to be dry all the time, so oral care is super important. The patient's not consuming any nutrition, so they're going to be having their nutrition parenterally. Okay, so parenteral nutrition, not enteral, because they're NPO, nothing by mouth. We're going to be replacing fluids. We're going to be replacing electrolyte values, because all those can be abnormal when you have pancreatic issues, folks. Now, when it comes to pancreatic cancer, keep in mind that the signs and symptoms do not necessarily manifest early enough for it to even be caught on time. Generally speaking, people like Patrick Swayze, he passed away from pancreatic cancer. It happened really fast because the signs and symptoms are very vague until it's fully developed within the system and it's metastasized elsewhere, and usually it's terminal by then. So because of that, keep in mind that pancreatitis is going to be one of those things that you're really able to visualize when the patient is having these conditions. Chronic pancreatitis is also an issue that can eventually lead to pancreatic cancer, because you have long-term irritation of the tissues, usually caused by, number one, alcohol. Second, it's usually going to be your stones. And thirdly, triglycerides. A diet that's high in fat content will eventually exhaust these little locations and will cause an accumulation of more lipids and more triglycerides, which increase the likelihood of it becoming obstructed and causing more of these issues, folks. Okay, keep in mind that common bile duct and the pancreatic duct both emerge at the opening right here, the sphincter of Oddi. So again, no morphine. No morphine. We give Demerol instead, because it can cause spasming of the sphincter of Oddi, folks. Okay, so I hope this kind of made a little bit more sense. Please follow me on Learn NCLEX Now on YouTube. Subscribe to my channel. Please tell everybody you can. Follow me on Instagram at Learn NCLEX Now, as well as TikTok at Learn NCLEX Now. Thank you very much.